My name is Julius Mwangi, and I'm the director of EquiHealth Global. As this year comes to an end, I would like to take a moment to reflect on the incredible journey we've had this year. At EquiHealth Global, we are dedicated to advancing health equity and health access in underserved communities around the world. And this year has shown us the power of collaboration, hope, and dedication in advancing healthcare in underserved communities. As we reflect on the key programs that we've had this year, I would like to highlight three: our NutriCare Program, our EquiHope on Wheels program, and our Policy Advocacy and Stakeholder Engagement Program. Going to our NutriCare Program, this program aims to target school-going children and their families in order to complement their dietary intake of proteins and micronutrients. And through this program this year, we've been able to distribute over 2,000 health and hope kits in underserved communities, mainly in Kenya. And this we've done in Murang'a County in collaboration with global partners, and for that we are truly thankful. Another program that we've had is our NutriCare event in Dylan Jones Academy, whereby we brought the community together and their parents and the students in order to address some of the challenges that they've been having. And through this program, we are hoping to seek for positive engagement and results in education, because we know healthcare, education, and social engagement are all correlated, and for us to see positive results, we need to bridge the gap between the three.
Surely the parents have really appreciated what you have done to them. The packet of unga, the packet of wheat flour, the packet of rice, and oil, cooking oil. This one is really going to help the parents. They have really appreciated it. Besides that, we are so grateful for bringing the person who has talked on the nutrition. It was so touching to the parents, and many have seen where they're going. Even it has helped me as the head teacher to know how I'll be doing, what I'll be doing to my children. Otherwise, I just want to say, may God bless each and every person who has participated in this activity. God bless you.
Our EquiHope on Wheels program seeks to promote early detection of non-communicable diseases in underserved communities. Now, non-communicable diseases can be diabetes, can be hypertension, can be cancers, or chronic lung diseases. And for these diseases, we've seen a direct correlation between financial catastrophic events and families that end up getting these diseases and do not have insurance or social protection, a financial social protection. And so our program seeks to promote early detection of non-communicable diseases by promoting screening and health education. And this year, again, we've screened over 5,000 people through our programs, both in Kenya and here in North Carolina. In North Carolina, we've done programs in Raleigh, whereby we have worked with refugee communities in Wake County. We've also worked in central North Carolina in a city called Statesville in collaboration with Fairview Baptist Church and Piedmont Health. Our faith-based partners are quite crucial when it comes to our programs, because they help in mobilizing volunteers who serve in our programs. And then also we've worked with faith-based communities in Kenya as well, in two locations, again in Murang'a County, but as well in Kitui County, where collectively we were able to screen for about 3,000 patients, and out of the outcome, some of the outcomes that we've seen through these programs are more and more people being diagnosed with non-communicable diseases who didn't prior know that they had these diseases, and out of that we've referred them to our agencies, our community agencies, and are talking with them about opportunities of collaboration so that we can look at their follow-up and also supply them with essential medication that they need.
My name is Orby Smith. I'm from Friendship Baptist Church in the coastal area of North Carolina, and I run Wings of Hope for Brunswick County, and we wanted to be a part of this today because our whole role of Wings of Hope is given to others and help and support people in their times of need, their greatest need, and food and medical are two of their biggest needs, and we're very thankful to be a part of that here with Julius and all the others that came today to participate. Plus, I love kids, and there's lots of children here today, and I've enjoyed interacting with them and learning about their lives.
I'm Barbara Hill. I'm representing WMU North Carolina. Our executive director, Amy Boone, was here and she had to leave, but we also had a lot of people from all over North Carolina donate things to help with the health bags, because we had toothpaste and toothbrushes and soap, and here's one of our bags. We were able to make sure that everybody had rice and beans and some kind of canned fruit, and also a health kit inside it with the Gospel of John, because that's our purpose, is to have people come to know the Lord.
Another key line program that has taken shape this year is our Vision Care Program, and this Vision Care Program is among the people who we've screened for non-communicable diseases. We were able to diagnose some who needed prescription glasses, and again through our global partners we were able to distribute these glasses to the people that are in need. And that's not the only thing. We've also had dental volunteers who've volunteered in our programs to provide cleaning and tooth extraction for many people who've come seeking for healthcare services. Now, during those screenings, as they come for dental services, they also get an opportunity to be screened for other illnesses, and we get to see dietary needs, we get to see other needs that they may have when it comes to healthcare. And through this program, really we are seeing an opportunity to scale and reach even more in areas that we've not been in before.
I'm very grateful because of the people who have brought the medical camp, and they promised to bring spectacles, and they have already brought them. We are very grateful on behalf of the people who have got the present.
Came here for a medical camp a few months ago, so we came for the specs, and we say thank you, because in this background of our village it's very hard for us to acquire these things. Our parents are not that, they cannot afford these things because they are quite expensive. We say thank you. May God bless you.
Our policy, advocacy, and key stakeholder engagement program kicked off this year through 2 annual conferences that we did in April. One we did in Kenya, where we engaged stakeholders from Murang'a County Health Department, and the director was able to talk to our volunteers regarding the priority areas that the county has when it comes to healthcare, and that really helped in ensuring that our efforts are geared towards meeting what they consider as priority areas according to them, and an opportunity for the county officials to engage with our volunteers in terms of collaboration. But we also did another annual conference here in Raleigh, North Carolina, where we invited leaders from the refugee community so that they can educate our science community on opportunities of partnership, because coming in as a community partner, we want to make sure that we are informed in terms of what the community deems as essential for them. And so our conferences this year was an opportunity for knowledge exchange, and we are hoping to advance this program next year, whereby we will engage more stakeholders. And the goal of this program at the end of the road is to advocate for policy change in underserved communities who don't get an opportunity to really be engaged when it comes to decision making. Some of the key matrices that we can reflect on from this year: we've had over 200 volunteers globally who have served in our programs. Now, these volunteers have come from different backgrounds, different races, and different parts of the world, but together collectively they have logged over 10,000 hours, and all of them are dedicated towards either promoting health education, screening for undetectable diseases, or providing meals to school-going children, and also engaging our communities in terms of what they deem as essential to them. And we are truly thankful to all our global volunteers who've given of their time, their resources, just to come and be with us, and even their skills, whether they were event organizers, or they were the people who are doing the media, or they were people who are helping in coordinating the long queues, the waiting times as people were waiting to get healthcare access. The other key metrics that we've had this year is the screening program. Through the screening program, as I mentioned earlier, we've been able to screen over 10,000 people for different conditions, and as I said, we were able to see new diagnoses of non-communicable diseases like diabetes, cardiovascular diseases. There are some patients who are on follow-up currently right now for early stages of cancers, and we will be able to understand better in days to come on how best to support them. But we've also had patients who've been diagnosed with eye problems, dental problems, and all these have been possible because really the volunteers are who've given of their time to be with us. Some of the key challenges that we've had this year, of course, we've had tremendous challenges that we've had to navigate. Some of the ones that have stood out include funding gaps. There is more that we've wanted to do in the communities that have opened a door for us to be there, but we have had limited resources, and so always trying to make the best decision regarding where best to invest the limited resources we have is always a present challenge. But also another key challenge we've had is logistical handles. As you would expect when you're working with different communities around the world, you need a lot of coordination, and we do not have enough staff members. We only have volunteers, and so trying to coordinate the logistics, we've had to rely on volunteers who've done so many hours, but as well we're looking at how to upscale that and pivot towards the future. In terms of the future and what 2025 holds for us, we would like to advance our programs, our NutriCare program. We would like to distribute our health and hope kits to more communities that are in need. We are already doing activities in Kenya, here in North Carolina, in the USA. We are proposing to advance to Uganda, which is a country which is next to Kenya in East Africa, and we are working with a community partner there in order to provide health and hope kits for cerebral palsy children and children who have genetical disorders, but also who their parents are incarcerated and do not have access to such supplies. Another thing that we're trying to do is expand our screening program, our EquiHope on Wheels program, so that we can go to more marginalized communities, and we target to screen over 10,000 people for next year. We are working with community partners here in North Carolina so that we can go beyond beyond Raleigh and start working with refugees communities in Greensboro, in Charlotte, in Winston-Salem, and in other places where community agencies settle refugees, but also looking at how best to support the programs that are going on in Western North Carolina through mobilizing and advocating for our volunteers to seek to go to such locations. If you'd like to join us as a volunteer, a donor, or a team member, please go to our website www.equihealthglobal.org and see how best you can join us. You can also send an email to info@equihealthglobal.org. We look forward to hearing from you. As I reflect upon this year and the success that we've had, I just want to really thank you because of your dedication and your commitment to seeing our success. We promise you that we are dedicated to promote health advocacy, health equity, and even health access in the most underserved communities around the world. We look forward to what is ahead, and we take on this challenge of the vision that we have, and we are seeking for people who are like-minded like we are and are seeking to make an impact in communities around the world. Stay tuned for more. We seek to share a good report of what is happening in EquiHealth, and we hope that you too will be able to join us soon. I would also like to take this opportunity to thank our faith-based community partners who've worked alongside us this year in 2024. In Kenya, we've had immense support from Moranga Mission Station, which is a collective of Baptist churches in and around Moranga, and we would like to thank them for their dedication and their servitude in how they've supported to see the activities of EquiHealth programs, EquiHealth Global in their communities. We've also had immense support from Fairview Baptist Church, and we would like to thank them from Statesville, North Carolina, together with Cornerstone Church in North Carolina as well, taking time to thank them because truly if it wasn't for them, we wouldn't have the volunteers and even some of the resources that were needed to see us go through this year. Thanking the Pentecostal Church of Kitui County that supported us in doing our recent activity that we did there, and services that are given by faith-based community partners do not just allow us to provide volunteers, but also the financial resources that are needed to advance our mission in the communities. Truly thankful from the bottom of our hearts and looking forward to partner some more.
And we invite you that are watching this and listening to be a part of something bigger than yourself and give back.
On 21st of December, we are sending Santa Claus to Kenya and Uganda. In Kenya, we are sending Santa Claus to the Dylan Jones Academy, and we are looking forward to have a community event day and a fun day for the Dylan Jones Academy children and the community at large. We'll be providing health and hope kits. We'll be having some music and fun, and even though I will miss out, there will be a lot of children and many community members there. We hope that you can walk alongside us to support that program. And also in Uganda, we are partnering with Doxa Foundation, who are organizing a Christmas event for cerebral palsy children and children of incarcerated parents, and we are looking forward to partner with them on the 24th and the 25th on Christmas Day. So there are opportunities for you to pray, there's an opportunity for you to give, there's an opportunity for you to share about this message. We look forward to the outcome of the same, and are truly thankful for many who continue to support us. Looking forward to a great event time, and yeah, wishing you all a happy Thanksgiving and a Merry Christmas and a Happy New Year.